This episode is brought to you by TaxAct. Don't do your taxes alone. Join TaxAct's National Admin Night. Admin nights are social gatherings for getting through your to-do list. So get ready for a night of fun, finding deductions, and filing taxes with TaxAct, where you can file your federal and state return for just $49 through April 8. Let's get together and get them over with. Visit taxact.com/admin-night for details.
Hi, I'm Chris Cotnor, executive producer of The Secret Life of Cookies and Deep State Radio. If you're enjoying this podcast, please be sure to subscribe to it on iTunes, Spotify, or wherever you get your podcast. The podcast will continue to be available in the Deep State Radio feed for the next several weeks. Thank you and enjoy the show.
Welcome to The Secret Life of Cookies, where we try to solve the world's problems through the miracle of carbohydrates, one recipe at a time, with host Marissa Rothkopf and her dog, Bosco.
Today's episode features Kavita Patel, practicing physician and former health and economics policy advisor in the Obama administration. We talk pro-cookie baking tips and COVID, including the pros and cons of the vaccines, the reality of our shared grief, and what to say to someone who's not wearing a mask. We also talk about pleasant things, including that most pleasant thing of all, chocolate. Welcome. Thank you for coming on the show, Kavita. Dr. Patel, physician, mother. Okay. Physician, mother, Brookings Institute fellow, former health and economics policy person in the Obama administration. And are you a very tired person now?
I was tired a long time ago, but that happened with med school. So I'm not as believe it or not, I'm not as tired as I was then some days. So that tells you something.
Okay. So it all becomes, maybe they do that to you. So it becomes relative.
It does. That's right. We're trained. Exactly.
So I have you on the show today for the most important thing, which is, of course, baking cookies. And then I also, there seem to be some things going on in the world that maybe we could talk about. And I want to talk to you about serious things and funny things and weird things and random things. So that's really sort of my to-do list. Yourself?
Great. No, I love it. My to-do list was to actually make somewhat healthy oatmeal chocolate chip cookies for my kids. So that's what we've done here, because here I gave you a recipe for a whole wheat oatmeal chocolate chip cookie. So it has the most important ingredient, which is chocolate chips. Mm-hmm. Yep. And no skimping on that.
No skimping on that. It's the most important part. Oats are very good for heart health. Whole wheat flour, once you start using it, I find in cookies, there's no looking back. Like you will find that if you make a regular chocolate chip cookie with with white flour, it will come across as way too sweet.
Do you just use a 1-to-1 swap?
I find that you can do a 1-to-1, although you have to do 1-to-1. A lot of recipes are measured in cups or measured by weight. Mm-hmm. And the tricky thing is, if you're going to go 1-to-1, then you need to use the cup measure, not the weight measure, because the weights are different of whole wheat flour and wheat flour typically.
Okay. Well, I'm too lazy to do weight, so the cups work perfectly well. That's fine.
So this is, I find that whole wheat flour, you can get beautiful, like pastry flour. You can get all sorts of different kinds of milled flours, whole wheat flours now that taste good. Some add texture. And I don't know about your kids, but my kids, when they were little, did not eat a wide variety of foods.
No, mine basically, my daughter who's kind of running around, she's actually a somewhat decent, she'll eat vegetables and kind of explore into the vegetable family. My son, if it's green, he won't eat it. So there you go.
Yeah. When my daughter was little, she was eating, I got some Amy's pizza that had spinach on it. I felt so superior that I was like getting my daughter to eat spinach, and she was eating it with a friend, and the little friend goes, that's spinach on there. And no more eating things with spinach on it.
That's right. Exactly.
Although I did do an article once about if I and I said to my daughter, I bet you can't tell if I scramble eggs and I put spinach inside the eggs, if I put enough cheese in there. You won't be able to tell if I blindfold you.
I've tried that with my son. And as soon as he sees something green, it's tough to roll. I've got a little confession, since the dough's pre-made yesterday. The balls I did not take out as I was instructed my hunk of dough early. So I'm trying to soften it up, and my daughter is chiming in that it's hard to roll. So
it is really hard to roll. And it also, I find that when I'm rolling oatmeal, it sort of makes my hand itch.
Yeah, it does. Yeah. Right.
It's like an exfoliant. Right. Think how beautiful your hands will look.
Exactly. No, I'm happy to do that. Exactly. After all the hand washing I do. No. Yes. Yes.
And think how delicious your cookies will be with all the, gross. Anyway.
Yeah.
So you are working kind of, it seems to me, nonstop, right? If you're not like on MSNBC telling people to that everything's going to be okay, or eventually will be okay, you're also now back in clinical practice?
Yeah, I actually the only time I left clinical practice for the majority of my time was when I worked in government, because it was funny enough, in the Senate, it was actually an ethics violation. And because I worked on healthcare issues, I couldn't do it. So my licensure kind of lapsed for the years I was on the Senate and in the White House. But then when I came out, I started back at clinical practice, and it's been almost 10 years now. So what I did last year is I shifted my clinical work into what's called a federally qualified health center, which are low income, kind of uninsured. There's an incredibly large population of people, even in the DC area, who still lack insurance for a lot of different reasons. So they don't have, so federally qualified health centers are actually part of the solution for what we would call a safety net. So I work at a great place. It's called Mary's Center. They're wonderful. The people there are amazing. And most of the workers there are from communities that have been hit hardest by COVID. At one point in time, we had like a third of the staff in our office who were sick with it, and obviously not at work. But so it's been pretty, the early kind of disparities that people were seeing, we were living, but we didn't even have tests at the beginning. It was taking me 7 to 8 days to get a test back. So we know that there was just a lot that we didn't know all these things like we do now, like that if, before we thought it was like fever, sore throat, or cough. And now we know things like, if you lose your sense of smell or taste, that could be an early sign. And I know we have so much more, but we were kind of operating blind. We were joking, but it wasn't a joke, that the early part of clinic, we were just like taping up plastic in the hallways to try to separate people who had respiratory symptoms from those who didn't. And that didn't do anything. And we had not really thought, I was on TV talking about how we don't need masks, or we shouldn't wear masks. So we all learned kind of on the job. So so that's, I do that, and it's very scary and gratifying all at the same time. And it's a word of support for, sometimes people overlook kind of federal programs and don't really understand some of the important roles they serve. But FQHCs, federally qualified health centers, or community health centers, are critical. Oh, there's the oven. The oven? Yeah, the oven's ready. So we need to keep doing this. I've got a little small helper right here. So that's, when you hear sweet noises, that's her. So we're just rolling, right, Marissa?
Just rolling and putting them on the pan and getting ready to bake them, because that's really all we need to do. I don't think getting ready to eat them. Cool. Yesterday, I think President Joe Biden signed back into effect the Affordable Care Act.
Signed a number of things. There's still some ways to go, but did a couple of executive orders that I'd highlight. The most important of which was opening back up the open enrollment period. So without any explanation, you can sign up for health insurance from February 15th to May 15th. Normally, that open enrollment period was 6 weeks. Normally, it's 6 weeks. And that, by the way, was truncated. The Trump administration took what was a 12-week enrollment from the Obama administration, turned it into 6 weeks. And unfortunately, also, believe it or not, dismantled like access to the website on Sundays. The website went down for maintenance service on Sundays, which, last time I checked, the only time people, especially working women who end up choosing health plans for their families, had time to do anything was Sunday night or Sunday or Saturday night at 2 a.m. And so they also cut the navigator programs. So if any of you have tried to buy health insurance like me, when I've helped my parents choose a Medicare plan, and I probably know more about health insurance than anyone else in the country, and it's incredibly complicated. So the Trump administration had decreased the funding for what's called the navigator program, which helps to like translate some of these important things to people and real people and words that they understand by 90%. So Biden basically opened up the enrollment period and also called for increasing the funding to support enrollment services. And then he did a series of other things that have kind of gotten a little bit overlooked. He overturned the gag rule around reproductive rights and kind of a pretty significant set of changes to basically not prohibit abortions as much as had been done in the Trump administration, as well as changes in the Medicaid program. And as a reminder, Medicaid is really also kind of the insurance program that actually a majority of Americans are on. And it's generally for low-income adults who might not have employment insurance or might not be able to afford or don't make enough money to afford to buy one of those plans on the open market. So that was a pretty big deal.
That is a huge deal. And since this is a podcast, nobody could really see the weird look on my face when you talked about Donald Trump, the Trump administration putting the website on maintenance on Sundays.
Mm-hmm.
Like that really feels like cartoon-like evil scheme.
Right. Yeah, but I mean, many of us who, unfortunately, many of us who worked on the Affordable Care Act or worked on I would argue like Ted Kennedy probably spent more of his life trying to figure out how to expand health insurance for Americans. And for those of us who have worked on this, like it was just one in a series of blows. And the reason I said that it's like what the president did yesterday was like what I hope is the first is because I'll give you a good example. In the tax bill that was passed during the Trump administration, they eliminated the mandate to have to buy health insurance. And I think there's been a lot of controversy around that because we put the mandate in for a couple of reasons. One, if you don't mandate health insurance, then only the people who need it buy it. And it ends up driving up the risk pool in a way that's pretty bad. So that's one thing. And the second thing is insurance companies need to feel comfortable offering health insurance to everyone. And they want to have as broad of a population to offer it to for a lot of good reasons. And so it's gone now. So you don't have to buy health insurance, but hopefully with these enrollment services, as well as some of these other things, we can actually identify ways to make sure people who qualify for subsidies. We believe that there are at least 5 million Americans who actually qualify for free premiums in the plans available now. Maybe an additional 5 million that qualify for Medicaid and didn't know it. And then another 5, maybe to 6 to 8 million who qualify but would receive some part of their payments subsidized and would have to pay cash out of pocket, but at a much more reduced rate. So all in all, we could see like upwards of 20 million people receive insurance, which is great.
And how does the word get out, right? Like we're not all watching the news all the time. And,
right. Yeah, I mean, I think it's a lot of us actually probably have people around us who are uninsured and don't realize it. So I think it's getting the word out. I think that's why I kind of emphasize these navigator programs. They're incredibly effective because usually the programs, they're usually grants given into community-based organizations that actually understand who's uninsured or why people are uninsured or speak languages that are familiar to those who might not have English as their even second or third language. And so those are their ways that it needs to get out, which is why I think it was important to offer these kind of grants. Should I put these in?
Yeah, put them in. I'm going to put mine in the oven too.
Okay, great. Okay, so let's put these in. Okay. All right.
as a physician, you must go to, in the olden days, people used to go to things like cocktail parties and like public events where friends would meet and gather. Do you remember things like that? Yeah.
I mean, I don't know who those people were. I have heard of them. But we used to do that we did a lot more when I worked on the Hill or in government. It was kind of like the traditional Friday, like, happy hour wind down. But what I do miss are probably, like most people, just the little things, being able to go inside a coffee shop and sit there. And I would definitely meet friends for coffee, or when I was really, my kids are 4 and 6, when they were really, really little, taking them in a stroller and meeting a friend who was also on maternity leave. And that was like life-saving. Like if I had to have a newborn now, and this, I just don't know what I'd do, because I spent so much time inside of, you name it, in DC, we've got these little bakeries, Firehook, bread and chocolate, right. And some of these places you could just stroll on into, and they kind of saw that you were like this tired, newborn mother, and they would just let you sit there with like a cup of coffee or a glass of water and just like have a mental break while your kid was either sleeping in the stroller or just like awake and screaming. So
right.
I don't know how people who don't have that do it, to be honest.
No. And the trick was to get your child, not the kid, I mean, I think so disrespectful, one's child to fall asleep as you were heading into the cafe.
Yeah, we would try to time it for their nap times and stuff like that. Yeah. Yes, so true. True.
And the idle twitch that you would have of just sort of like idly rocking to keep the motion.
Yes, exactly.
I still find myself in line sometimes sort of stimming back and forth. I think it's because I'm like in perpetual rocking mode,
Yeah. Well, it is. They call it, I forget, it's like 4 S's now. Shushing, swaying, which is that. There's like shushing, swaying, and 2 other S's where they've been shown over time to work also in adults too. Like so I found myself when I used to travel for conferences or meetings, sometimes I have a hard time falling asleep in a new place, and I could just take on my iPhone and play it was like that. And it actually works. Like it worked on my newborns and it works on me. So, absolutely.
That's a great tip for all of us.
Exactly.
That and like wrapping your child like a burrito was very important.
That was it. Oh, swaddling. There you go. Swaddling. See, there you go. So we're missing 1 S, but 4 S's. It was the shushing, swaddling, swaying, and then something.
Yeah. As a doctor, do you find that like your friends are always like hitting you up for advice?
No, I mean, it's kind of a selection bias. Most of my friends are doctors. So we end up comparing like advice because they'll have something. I'm only an internal medicine doctor, so I only cover 18 and above. And where I have my own blind spots is with pediatric illnesses, childhood stuff. So I talk often to my friends who are pediatricians. That doctor thing happens a lot more with people who are very casual. It's funny how bold people are to like ask me incredibly sensitive medical questions over email or Twitter. It's very interesting to me. I mean, I don't blame them. I think everybody's kind of trying to just get better information, but it does tell you something that's, where we're at.
Yeah. Like, do you want to look at my rash right now? That sort of
thing. I mean, I've had my fill of pictures of things inside of toilet bowls. Let's put it that way. I've had my fair share of pictures of things inside of toilet bowls. Yes.
Really?
Oh yeah. I had just 4 this past week. So yes, it's
Like 4 of them. Mm-hmm. So it's not. So that seems
not rare. No, not rare. No. I think it's again like I find that with the surplus of information, people actually lack kind of trusted information. I guess it's like that's probably a lot of it, and that seems to be the issue. That on, whether it's the Deep State podcast with David or, on TV or radio or print, it's just information, right? People just want information and they're not necessarily sure how to get it or how to trust the people who give it to them.
Right. Because they're lasers from space that are starting forest fires.
Yeah. So, right.
A Jewish run lasers that are starting forest fires. So with that sort of information out there, I think that's, to me, one of the, as a layperson, one of the greatest challenges with COVID overall is
Yep.
the lack of not just, I mean, there's plenty of information out there, but there's not plenty of sense. I'm sort of pointing at my skull.
Or context. Yeah. You can't, like, just rattling off a bunch of statistics without grounding it in like your context. Like we were talking about all the new vaccine information that's come out in the last 24 hours. And, you know, it's very easy to say, oh, this one's better, this one's worse. But there's so many factors and kind of, you know, like, you know, what makes something right for one person may not make it right for another. And it's hard to do that, you know. That's why it's sad to me where a lot of like the most precious time, you know, in medicine is the most precious commodity in medicine is time. So it ends up being kind of sad that I hear a lot of people who, if they could just have 15 more minutes with like a doctor or somebody that they trust, they would get a lot more information out of it. But our payment systems and the way we pay people does not allow for that.
Yeah. I mean, I had my own personal experiences with one of my doctors was a real old timey doctor, and as my OBGYN, he would see me with clothes on first and then see me in the exam room. And then I would put my clothes back on and go talk to him. The difference between talking to someone with clothes on and without, even that makes a huge difference.
No, and it's funny because we're under such pressure. Oh, before I get into this very kind of sophisticated ethical discussion, is this like 10 minutes, 12 minutes?
It's about 10. It depends on your oven, but I would say about 10 minutes. And
I'll check on it.
I think one of the things I was struck by, I was just in beautiful uptown, downtown Altoona, Pennsylvania this past week.
I know where Altoona is. Yeah.
And Altoona, I went into a restaurant to get food to take back to my, you know, hotel room where I, you know, wore 25 face masks. Did I mention I'm a hypochondriac?
It's okay. You've got a lot of friends. You're not in small company.
No, and a hypochondriac with anxiety, like all these people are like, oh, I have to wash my hands now. I'm like, where you been, people? None of this is new.
I know. It's kind of funny, isn't it? They're like, we have to wash our hands out of the bathroom. What? Yeah.
Really? When you come in from outside, yes.
It's crazy.
Keep soap. Anyway, Altoona, Pennsylvania, walk into a restaurant. It is like Saturday. It is Saturday night, but it's like Saturday night in 2019. The restaurant is packed with people. People aren't wearing masks while they're not chewing, you know. It's mixed families at tables, you know. It's not just like you in your pod, and the tables are right next to each other. So how do we get through to people? I mean, or is there no way? I mean, I've talked to people who are health professionals who are like, no, this COVID thing isn't quite real.
Yeah, there's actually, you know, we've talked about kind of background and, you know, people from Texas, and my friends, some of whom are physicians in Texas, there's a pretty significant portion of them who have refused the vaccine. So they're not comfortable. I actually had a very long conversation that I decided I just needed to like walk away from with a friend who's a nurse believe it or not, in a cancer ward. And she said, not enough data. I actually wrote it down because I was so struck by it. She's like, well, there's not enough data. And I said, well, there is pretty good data. And it's also pretty impressive, like what we're seeing, like with people who get sick. And, you know, I wouldn't want to take those risks. And she's on the getting sick side. And then she's like, well, this is really, you know, the government's just doing an experiment on us. And I said, okay, well, if you really believe that, then can I ask, did you get a flu shot? Yes. Did you get all your shots when you were a baby, like measles and mumps and rubella and polio? And she's like, yes. And because we're in healthcare, we also get vaccinated against hepatitis. And she's like, yes. I said, well, what made that different from some government conspiracy? And she's like, well, you know, it's not necessarily those people that did it back then were not as bad as this government now. And it was funny because when Trump was president, she's like, oh, I think it's great. And she truly believes that the change from power makes anything that they're endorsing not appropriate. And it is something that I've always worried about, that like there was this sentiment that it can't be good if it's, you know, kind of supported by this White House. And, you know, there was some damaging statements made when Trump was president about how you'll recall that there was a pretty controversial statement, and I'm going to get the exact words wrong, by Governor Cuomo, who said that he didn't trust. Basically, you asked, and several other states followed, was setting up their own vaccine approval committee, right, which, kind of reflected, I think, the cynicism, and rightfully so, because we had a White House that was actually advancing things that were not scientifically proven. But it then becomes hard for the public to understand the difference. And I think that's like a real tragedy. So I think the only thing you can do for a place like Altoona is to not, it would be foolish to say they're all dumb, they don't know what they're doing. I think that a lot of it is complicated and wrapped up in businesses need to survive. Most people, especially in small communities, feel comfortable with their local businesses or know the people who run these restaurants and know the waitresses and waiters. And what we needed to do was actually pour money to the small businesses, then pour money to people to actually be able to stay safe and find some way to, exist. And we didn't do that. And we're not doing that still to this day. And so we're forever going to have a population that thinks this virus was no big deal. I didn't get sick, or if I got sick, I didn't die. And so that must be okay. And somehow the 435,000 deaths don't seem to register. And that's what, so what we did, it's not one fault. It's a series of events, so yes, that's my answer.
It's a real challenge.
The best thing, my son came back and he had a lesson in fact versus fiction. I thought that was great. It was like very basic, like what's a fact? What's fiction? And it wasn't that easy, like it was not things like, oh, there's a Santa Claus, there's not, but it was things like, it was things like if someone tells you the sky is orange, is the sky orange? And it wanted you to go through critical thinking to say, well, I can look outside and I can see what I see. And, I don't think the sky's orange, and that might not be a fact. Or, what's a fact? And so I think rewriting or even writing some of those narratives would be great. I really do, especially coming out and trying, I've seen so many people who are trying to look at this top line data and say, well, if something is 95% effective, doesn't that mean it is perfect? Or what does that mean? And we don't have enough, I'll call it mathematical literacy to understand any of that. And it doesn't mean, just as a PSA again, if you have something that's 95% effective, it does not mean that if 100 people get the vaccine, that only, 5 people get COVID. It just means that if 100 people get the vaccine, there is a 95% reduction of risk of dying or getting moderate or severe COVID compared to a population. And that's not easy to abstract, like comparative statistics. And, so if there's one thing that we could do, it would be to do what you're talking about, and then also infuse some better education around basic science and basic statistics and math in some ways. I hate to say it, like the phone has made it easy for me to never have to think about math, but being able to compare populations has been being able to explain to people what the infectivity rates are and are not of greater than 1, and what does exponential spread mean. The virus is demonstrating every single one of those principles every day, and we just don't understand them. That's partly why the media, there's a slew of us on television who are trying to do it, some a little more sensational than others. I put myself in the very calm kind of, I'm not shy about saying that what Trump did was malpractice, but I don't think these are things to get incredibly emotional about, because I think that many of us know that we're in this for a long period of time, and it's not good to scare people with tales of mutant viruses, but it's probably better to just level with people and say, here's what we know. I can promise you this will change in about 3 months. That's about it. And that's all I can do.
Well, I think one of the biggest problems right now is people don't have an end goal, right? There's no and we all want to know that at some point I will resume my existence as it once was.
That. But we need that psychologically. Mary Trump could probably tell you even better, because I think, she's done this her whole life. But I've always felt part of why people need a light at the end of the tunnel is because if you don't have it, if you study societies where you've had populations incarcerated or suppressed because of like oppressive regimes, you start to see that like there's actually a genetic effect and people lose the will to live. And so you have to have something to live for. So it's important for me to be able to say, Marissa, we'll be able to do this in person, hopefully in about 6 months. You know, it's important to have some goals and have something that you look forward to. It just has to probably be recalibrated. So I'm going to take mine out because I think they're probably just a couple more minutes. So
okay.
I'll look for that. But yeah.
Because these have a lot more brown sugar in them than white sugar, they tend to turn brown a little more, brown.
Oh, those are okay. Yeah,
more quickly.
Yeah.
Just so you know. They can
I think it's just the chocolate quantity that they care about.
No, I'm just saying because as the baker, it's made brown. It goes from a nice color to, oh my God, these are really quite.
I think the best takeaways for me, I can substitute whole wheat flour for white flour. And then that I can pre-make the dough, and I'm not going to say I'm going to ever freeze it because I'll never do it, but it's way easier because that's part of the whole, like, using the standing mixer and mixing the butter, and it's easy. But if you can do it like on a Saturday and then wait for whatever, then how long does the dough stay good in the fridge, by the way?
About a week. About a week. I mean, so that's, and who's like, does dough really last in a fridge that long? No,
but I'm just asking, like, you can keep it in there like a couple of days and it won't, nothing terrible.
It won't go funky.
Okay. Cool. Yeah.
I mean, I'd make your limit about 5 days.
Yeah. Okay. Also,
don't go
good to know. Yeah.
I mean,
exactly.
Sugar is a great preservative. So it kind of helps keep things.
I've kind of lived my life that way, but
exactly. I'm actually I'm 95.
I'm 90 exactly. I was going to say, like, I feel like that's a problem. That's also another. People all think that, like, just because we're in healthcare, we're all healthy. We're human, just like everybody else. So I had at one point another postpartum, probably a sign that I was probably not, the happiest in my postpartum period. There were full-on boxes, Amazon boxes full of full-size candy bars that I had ordered just for me. So, like, my husband at one point was like, I think we have a problem. And I was like, what's the problem? Like, what is wrong with me having my own full-size candy bar every single day? And I now that some years have gone by, I'm like, that was probably not my finest hour, but you're just, so yes. So there's definitely a limit to sugar. And I've learned to appreciate the different qualities of sweet things, like the appreciation for better chocolates versus the stadium box of candies. But I definitely did that. And I think that also leads to, like, what a lot of Americans are doing now, where they're just grieving and they're trying to cope with, like in essence, the loss of being able to be in person, or the loss of being able to meet in person. That's grief. That's grief that, like, we just don't have a way to process. And so,
or acknowledge,
people are doing it, or acknowledge, and people are processing it or not acknowledging it, or acknowledging it in different ways. I was eating, I didn't exercise. I know some people who have not, like, left their house in months. And, I actually now have had, like, several people who, since I've now been kind of quote immunized, double shot, and kind of down under in my arms, I've had patients who, like, when I do a physical exam and I'm more comfortable, I still wear all my masks and I look scary. And it's funny because they say sometimes they've never seen my face, but then they watch TV and they're like, we didn't know you looked like that. But so when I touch them, they're like, nobody's touched me, in years or months. And it's just, so I think our country's going to have to process. So I highly encourage the act of, like, rolling cookies is very therapeutic. So I encourage the non-cooks. I know Mary Trump had her brownie box mix, which I totally do all day, but I would say rolling cookies is maybe a better substitute because you get the, like, tactile energy.
I think that's why a lot of people turn to making bread.
Yes, I hadn't noticed that was like a big COVID trend. Like a girlfriend was like, I mean, have you tried making all these easy breads? And I'm like, is there such a thing as an easy bread?
It turns out there are, because I've never been good at making bread. And it's never been something that I focused on.
Maybe we'll do that for another one. We'll do. There we go.
My daughter. Do you see my daughter?
I do. She's tall enough to reach. I've got a little bit of power over the 4-year-old. She's just not quite. She's like down. She's down here. She's not. She's now like. She's like, whatever. I rolled the cookies. I'm done. She's off. She's off just playing with her stuff. But yes, it's. I don't blame. Warm cookies is like
cookies, right?
Me. I mean, it is. There's something very happy about the smell. So yes. So this is great therapy for anyone who's going to listen. It's very easy, right? You'll have the recipe up. It's
so
super
simple.
easy.
It's super easy. And
if you don't have, what do you substitute? If you don't have like those traditional oats, can you just leave them out?
Just leave them out.
Yeah.
Leave them out. It'll be fine. The oats really just perform a sort of textural sort of experience. And health-giving nutrients. Don't forget health-giving nutrients. It's very important to talk about those.
I mean, I did use good chocolate in my morsels, so there. I feel like I'm a big unpaid, unfortunately, proponent of guitar chocolate from San Francisco. We use that for Thanksgiving for a pie that my husband made. He's the one you really need to have on because he made from scratch 3 pies, and he made one of those. What in Texas again, what I would have bought from Marie Callender's, it's like the chocolate mousse with the whipped cream.
Oh my God.
It's like a French silk pie. Is that what it's called? Maybe.
Yeah.
He made that crust and all from scratch for Thanksgiving, and it was just the 4 of us. It's like we had anyone over to do it. So there was like, and mind you, that 2 of us are 4 and 6 years old. So we had that.
I have so much more. You know how I respected you as a medical professional? Now I respect you as a human.
He made it with guitar chocolate. It was game changing. So we got it by accident because we were trying to buy groceries kind of last minute, and that's the only chocolate they had. And I was like, what is this guitar chocolate? And he's like, oh, it's very good. And it was, whatever on sale at Whole Foods. So I bought it, and he made French silk pie from scratch, apple pie from scratch, and my favorite pumpkin pie from scratch with the crust. So he's the real talent that needs to be on the show. But, you get easy cookies from me.
I would like to make French silk pie with them. Guitar's chocolate has no sort of aftertaste like some chocolates do.
Yeah, I noticed that.
So intense and so pure. And even their milk chocolate, and then they do an extra dark chocolate, which is
cool. Okay.
Really, really nice.
It does make a difference though. I never had appreciated after I had bought my box of stadium size candy bars. I had not appreciated different chocolate. And I really do. I describe that as like, I sometimes joke and I'm like, oh, we've really become part of the 1% now that we understand that not all chocolate is this like hyper processed milk chocolate, but it gets back to, getting us back to more serious things. It gets back to like, how do we, it's stunning to me that we have now more food insecurity because of COVID, more children going hungry. I was trying to talk to my kids about this. They're like, you mean kids don't have food? And I was like, they don't. And it's hard to get, sometimes those issues become so overwhelming that you're just like, I don't know how to start. But I think our country started by putting in a president that actually had a brain and has a plan and has like an incredibly competent team behind him. And I'm really looking forward for 4 years, at least. I know I'll be able to breathe, and I really am excited, about what's to come. So I think it'll be better.
After a reasonable amount of crying on Inauguration Day, I felt like I should be purged from the past 4 years, but I realized it's a trauma, that it was traumatic, and that I sort of, and I don't know if you feel this way, for me, it's a feeling of sort of unfolding slowly, that like my whole body was in one giant knot for 4 years. And even though I think it's important to note that there's grief associated with COVID, and not just grief associated with people dying.
Right. That's right. Marissa, that's right.
That we're all experiencing something so physical. And the other place that we see it, and if anybody has been reading the newspaper in the past week, my town, Montclair, has been in the news because our union is fighting with the school board and about whether or not they should go back to school. And the knock-on effects of kids not being in school is mind-boggling to me, because
Yeah.
from
Yeah.
like little kids who aren't learning how to read to the mental health effects of it are stunning. The number of suicides, near suicide, not the number of near suicides or discussion of suicide among kids in this that I have sense of is stunning.
It is. And it's also just to kind of ground it in science a little bit, they've done some studies to measure levels of cortisol, which is an indicator of stress in children, young children, and they're way higher than they should be. And it just shows that, like, we're arguing about, by the way, on the school reopening issue, there's no winners. Like, everybody's a loser. Everybody, parents are losers. Kids are the biggest losers because it's their education that we're talking about. And then teachers are, and the staff at schools are it's a losing situation for everyone. And I will say this again, Marissa, a fault of the Trump administration for not making that a priority. Kids don't vote, so they've never been a priority. And they also get neglected because why not shut schools down? What's the big deal? And then we find out about, I have a patient whose 6-year-old daughter has been regressing and like needs diapers again. And then another person whose kids have said, like, because lunch was where schools were how they got lunches. And so, like, schools are trying and they're doing like kind of boxes and trying to get food to kids, but nothing's perfect. And it just, it breaks my heart. And it's like, it's funny. Like, I think even before I was a mother, it broke my heart. But like, you see that and you think about, not being able to like give food to children. And you're like, that's like, this is the United States of America. My family left India because in India, it's normal to have kids begging on the street. When I was young, the first memory I had landing in India, and this is before 9/11 and all the security, kids rushing when I came off the plane, asking me for money and food and begging. And I was like, oh my, like, what is this? And you don't see it, but it's in the United States and it's worse. And, it's not going to be easy for one president or one White House or one Congress to fix that. This started before Trump. I have, it's easy for me to just blame it all on him. And a large part of it rests on his shoulders. But we're talking about ills, Marissa, that, like, took generations to achieve. And it might take generations to undo. And I hope that we can do that, and anybody who's listening, I would love, like, the people who could use the most support right now are your area food banks. It's like they are incredible people doing incredible work. All of them, Montclair included, all of them are like just, the only safety net for people around this. So anybody who's enjoying this, go find them.
Go find, in Montclair, there are a couple, and I support one called Tony's Kitchen that does the backpack program for kids. And every week, and first of all, the backpack idea is such a nice idea. So there's not like, I've got my bag of groceries because I'm underprivileged, that I need food.
Right.
So I have a backpack. It's something kids carry, and it's filled with protein-rich things like tuna and
easy to kind of eat and like make. Yeah. I mean, I think we're learning a lot more, the old food stamps program, right? The old food stamps program. I mean, it was basically like that box of candy, that I ordered. And
right.
I think they were trying, Michelle Obama did, kind of overhaul. If you remember, we went from like that food pyramid and then went to like a plate that actually makes a lot more sense, especially for Americans who are like, I don't know how to like eat by a pyramid, but I know how to eat on a plate.
It involves sort of a mathematical approach. So
it does, exactly. So we do a lot of good things, but it's just not very, it's like easy to say and harder to do. So all those programs are huge. And I think all of the, like, sentiment that we have about how can we get out of this, it's going to be through kind of that program. It's going to be through things like this and connecting, acknowledging what you said is that unwinding and the grief. And then also really taking that moment to like think about people that you don't think about. It's easy to kind of stay in my like, square foot home and not acknowledge like the outside world. But I think we have to, and that's, to me, watching the inauguration, it was actually like a kind of a moment where you're like, okay, somebody sees us, like, like somebody sees us. That beautiful poet Amanda, there's so many moments that were important for where we are, but hopefully a start to something better. So
yeah, I'm a historian sort of by training, and if you look here, I have an old book that was my grandfather's, who was a physician, called The Great Epidemic, which is about the Spanish influenza. And I have Gina Colada's really good book about the flu. But as a kind of cultural historian, I'm really interested in seeing where we go from this. What you can look at the 20s as a sort of easy reaction to World War I and the Spanish influenza. And art is often born out of it, and those are positive things. But I hope that there's this is my sort of wistful liberal bubble thinking, I get, but I hope there's more of a realization or a reaction to the issues of hunger that plague this country. So this person, I'm the luckiest person alive, right? I have whatever I want to cook.
I think it's funny, Marissa, I know we're going to wrap up because I have my beautiful cookies and I need to eat them, and maybe share them with my family. But I think that I've had to kind of like I used to feel bad, like when my family crossed a threshold of kind of not having anything. We were on food stamps. I also thought like they were fun stickers. So I would show up like to school with like, and it was back then, it was like these yellow stickers with like barrels on them. And I remember being like, why are people laughing at this? And so when I crossed that threshold and like started to actually make, my husband and I, we didn't buy a home until we were like 40 years old. So, we did a lot of things later because we're both doctors and it takes like 20 years to become a doctor apparently. So when I crossed over that threshold, I felt really guilty. And I realized that like, that's not productive. I need to be proud of what I accomplished, but I also need to make sure that I never forget. Like, I don't want that moment when I was a little kid and I was in that plane off of India, and that moment should never go away. And I think that's probably where hopefully the country, for those of us who have, and those of us who can, it's not just about like the charity, it's just remembering, like, so that we don't, it's what you said, that you're a historian, we can't forget. I think that's the key. Like, if all we do is say, okay, we got the vaccines and we're all better and life is back to normal, then we didn't really achieve much. That's not the point. But I'm really excited that I do think in 6 months I'll be able to see you in person, and then you can show me how to make bread and all sorts of other great things.
And the thing I was going to say about making bread is it's so involved, especially if you're not mixing it. If you're kneading it by hand, it is very physical. And the end result for those of us, a little lonely and can be this incredibly, lonely. But people, who are missing tactile experiences, really nice bread dough feels like the softest thing. It feels like it's just so lovely.
I cannot wait. It reminds me while you were talking, I know, so this is going to age our listeners. It reminded me of that scene with Demi Moore and Patrick Swayze in Ghost when she's at the pottery wheel.
In Ghost? Right, exactly.
So maybe we should start having a soundtrack when do the kneading and do all that. I think that's in a deep state. I might make that recommendation, Marissa.
I think that's a great idea.
I think that we need a soundtrack to some of our activities.
Do you want me to start? No. Let me ask you just a few questions before we leave in the sort of lightning round of,
yes,
I am, as we have been sort of saying all along, I'm pretty clever. And like I said, I'm a professional hypochondriac, so I know a lot about medicine. But there's a point where I don't want to process anymore because it's just, I'm not a paid professional for that in that respect. So I just want to ask you a few questions just to help out. I've asked my friends too, like, what do you want to know? But this morning, the Johnson & Johnson vaccine, some people are really, really happy. And some people are, hey, it could be good. So
when in Washington, D.C., we have a saying that if you have a policy that everybody loves, you've done something wrong. And I use the same kind of phrase here. So I'll say this. First of all, it's like a press release. They did include a lot of the details in the press release, but I really will want to see some of the graphs with the data of the relative risks and kind of comparisons between age groups. It sounds like they looked at a lot of age groups. Here's what I'll say. If this vaccine had come out, if this news had come out in November, we would have been jumping up out of our seats and like doing high fives, because the threshold for the FDA to authorize a vaccine that they set way in advance was 50%. Mm-hmm. So, and just to also put some context to it, vaccines against viruses are not great. And the flu vaccine is a great example. In good years, we get about 60% efficacy for the flu. In 1 year, 2004, our flu vaccine only had 10% efficacy. It was essentially useless. So if this had happened 4 months ago, we would have been jumping for joy. How can I get 1 billion of these shots, right? But because we've got these highly effective vaccines that are from a different technology, might be why they're more effective, candidly, it's created a conundrum now, because who's going to want to get something it's what people are all asking, like you, why would I get something that's less effective? I think this is going to come down, though, Marissa, to if you have an opportunity to get the vaccine and it happens to be the Johnson & Johnson vaccine, because they are going to apply and probably get it authorized to be used in the United States, I would still take that vaccine for a couple of reasons. Number one, in the population, in all populations, it appears that they reduced the risk of the most important things in COVID, which moderate and severe disease and death. At the end of the day, like, if I could get a guarantee that I'll just get mild symptoms, even though we know these long haulers and long COVID can be bad, if at the end of the day, I know that I won't end up in the hospital and die, that's what I need, because we've got kids and I've got a family and we have an obligation to them. But that's one reason. And it had about an 82 to 85% efficacy in that primary and secondary endpoints. And then it performed, and then it degrades in its performance against these strains and all the mutant strains, UK, Brazil, South Africa. And all that tells us is that these strains are outpacing the vaccines. But that's true with the other two as well. But, if you start at 82 and you just keep going down, then you're going down. But the other reason I would take it today, if it was the only one offered, is because, Marissa, unlike the other shots, you get immunity after one shot. And that's not trivial. Like, cases are so high that your chances of getting things are much higher now than they were even 6 months ago, or well, not in New Jersey, but it's all regional. So cases are higher now. And if you can get the vaccine and let most of the country get it, cases come down. And I can tell you, Marissa, you're going to need another vaccine probably in a year, and we'll have more production of the ones that are potentially more effective. And then, that's it. So if I had a choice, I would definitely choose the Moderna and Pfizer one, but it might come down to not having a choice, and I'll take what I can get.
Right. And know that a booster will be something that you'll have to get anyway.
It'll either be a straight up booster, or it might be just a different vaccine manufactured by a different manufacturer. Boosters generally come, it's just kind of a different shot. So we might have to do another. It's not clear to me if we're going to need to do just a booster across the board, or if there might need to be a totally new vaccine, or a little bit of both. And I think that's the part we don't know.
Am I correct in thinking that I can sleep better at night because the Biden administration is more on top of this?
Definitely. I mean, I think, yes. However, for them to get their job done, it's going to take a lot. So yes, you can sleep better, but you shouldn't let that make you comfortable. Does that make sense? Like, you shouldn't be a hypochondriac, but you should continue to be, as I tell family members and people around me, act like everybody outside of this house has COVID. Like, act like every single person has it, and get a good mask, one of these blue surgical masks, and get a high quality mask, and act like every person you come into contact with has it.
Do I need to wear two masks?
It's become a controversial question. I don't like wearing two. I think it's far better to get one that's better quality, and these are on Amazon. They're the surgical ones. They're actually 3-ply. 3 layers with a filtration material in between the 3 layers. And different studies show this can block up to 85% of particles. So it's pretty good. It's what I wear when I leave. It's what I use instead of my N95s I keep for clinic, and then outside in the real world I keep this. And I would say it's better. I've seen though there's a lot of controversy about 2 or 3 or 5 masks. If you don't have access to high quality masks, then taking 2 fabric masks, which are generally 2 layers, and putting them on top of each other achieves the same goal. I find it to be kind of clunky and claustrophobic on my face, so I don't like it. But some people don't mind it. So I'd rather you just get one good one and wear it well.
And one other super important question that comes up in my family a lot, is the blue side or the white side the one that's supposed to go out?
Oh, the blue is supposed to go out and the white is the one that's supposed to be on the inside. And that just has to do, by the way, it's how people can tell. The reason there's even a different color to it is because of there's usually a little metal kind of thing in the top for your nose. And it's just the way that thing is kind of sewn in. So you're not doing it wrong if you wear it the other way. It just makes that way that metal thing bends around your nose. It's kind of awkward. So it's supposed to be the blue on the outside.
So my children win. Fine. Okay, great. Thanks. And I guess I could ask you about 1,000,000,000,000 questions. I suppose you need to go at some point because I'd like to have a very long discussion about monoclonal antibodies.
Yeah, let's do it. Yeah, I'm happy to. We can. I'd love to try to also do another healthy set of treats for my kids. So if we can brainstorm and do. I was actually trying to think could I do something that has there was a zucchini chocolate cake that my son did actually eat. So, that was not green that he could see. So we could do something like that or something.
I have about 483 zucchini in my refrigerator because of, and so I was going to actually do the same. I was going to make a chocolate spice cake with zucchini.
Yeah,
so it turns out, and you can come back on and we can talk monoclonal antibodies.
I love it.
My last question though is, am I allowed to yell at people who aren't wearing their masks properly?
You are. It's just that I think our society has gotten to a point where you might get the finger if you do it. And I'm not sure that that's exactly going to make you feel good when you're already grieving. So here's how I've handled it. And I see it all the time. One, I definitely try to get away myself because I'm not so sure me yelling at that person is going to make them change behavior. And so I try to get away. When I can't, I actually have taken I have a bunch of these and I've just said, I've truly guilted people. I'm I'm a healthcare worker and I really can't afford to get COVID. Do you mind wearing this? And 9 times out of 10, they're like, oh, okay. And then they do this and then they walk away. And I'm sure they throw it on the ground because I see these on the ground everywhere. But that's probably the most friendly advice I would give someone because you don't want to you don't want to have that one guy or girl, woman, man be the one that's I'm going to come after you, Marissa, with a knife in your car. And, that's back in the old days when we went to watch movies, that was the start of every horror movie. So I think that the best thing is to, carry a bunch of them in your purse. And if you are going to go someplace like the grocery store, generally speaking, though, especially hopefully in New Jersey and DC, people are really enforcing it. So the other thing to do is to go get an aid at a store. And they usually, because they've got a name tag and they usually have a little more authority about it, but definitely get away from that person. And it's definitely uncomfortable. I've been there many times.
Well, that's a very good advice. And it should keep me out of trouble.
Yeah, that's right. Well, thank you for having me, Marissa.
Thank you so much for being in here. I will work on my chocolate spice zucchini cake.
All right.
I hope
it's a promise. Yes. Thank you. Oh, yeah. Oh, they'll love the cookies. I do already. I'm going to eat one. Yes.
You deserve the reward. Okay.
Thank you.
Talk to you soon. Thank you so much.
All right. Thank you.
Bye. We hope you've enjoyed The Secret Life of Cookies. To download the recipe for the whole wheat oatmeal cookies, visit marissarothkopf.com. Follow me on Twitter @MarissaRothkopf. And please, oh please, subscribe to this podcast wherever you get your podcasts from.